Hi parents, Dr. Tony Ebel checking in here on behalf of the PX Docs Network, and we are here to walk you through our sensory processing disorder test. Now, right out of the gates, I gotta tell you, if you're watching this video all by itself on YouTube or on one of our social video platforms, make sure you get to the article link as well. I'm sure it's in the copy or the text. You're gonna wanna read the whole article and catch all the links that even add more science and more understanding and more relatability for you or to you as a parent within the article from the pxdocs.com website. So what I want to do with this video is actually want to show you the sensory processing disorder test that we use. Now, before I click over to the iPad and I literally show you through a real life case study how this technology, how this sensory processing or sensory integration test really plays out, let's provide some contrast to you. Here's the deal with sensory processing disorder. Number one, it is super overlooked. It is almost always dismissed, especially in little ones in 1, 2, 3-year-old kind of age range from pediatricians who really don't always understand the neurology, neurodevelopment, neurosensory function, especially quite to the depth that we do with our specialty. And they'll often say to you, don't worry, they'll grow out of it. Oh, those tantrums, all the difficulty with transitions, all the difficulty with certain foods or certain clothes or certain textures or certain sounds or certain lights, right? We could go on and on with where sensory processing disorder shows up in your life day to day. And the worst thing ever, I feel, is when doctors dismiss it. When professionals say, oh, it's just who they are. It's just how they are. They're just 2, they're just 3, they'll grow out of it. What we know about sensory processing disorder is that there's precursors. We call it the perfect storm. There's a lot of stress during the pregnancy, intervention at birth and labor. There's a lot of colic and indigestion and reflux and constipation and kind of some motor developmental delays that show up even earlier, those first few weeks, months, and year or so of life that will lead into sensory challenges. And the second piece of contrast I'll give you just to reiterate what we write about in the article before we get to the test is, hey, there is real neurological stuff going on here. So just putting you through a test that is really just a bunch of questions about your child's symptoms and then labeling them or diagnosing them as sensory processing or SPD, well, that's not going to ever get to the root cause. Because if you're only focused on symptoms through your examination, your diagnosis, your evaluation, well, then the only thing your action plan and the care, they would use the word treatment. We don't. We use the word care for a child. We don't treat, we don't cure. We take care of the root cause and the neurophysiology, and especially in this case, the neuromotor dysfunctions that are causing and creating those sensory challenges. So we take care of that so we can take care of the challenge itself. That's why our test looks at the actual function of the nervous system instead of just the symptoms of your kids. So with that, let's get started and take a peek here at exactly what we're looking at with our sensory processing disorder test. And we're going to do it through the lens of one of my favorite patients of all time, little Miss Maddie. Now, Maddie was a spitfire sensory kid. She is spunky. Perhaps I'm an Iowa farmer before I became a neurologically focused pediatric perfect storm chiropractor. So I speak in some pretty plain English here for you. And what I will tell you, sensory processing disorder is spunkiness disorder. Sensory is the spunky kid who has a lot of emotions and a lot of meltdowns and a lot of tantrums and a lot of difficulty falling asleep and a lot of difficulty with certain foods, probably some difficulty with motor milestones, gross and fine motor, and a lot of times, like Maddie, significant difficulty with digestion as well. One thing that Maddie struggled with, in addition to her sensory challenges and really SPD challenges that Miss Maddie had, she really had significant challenges also with pooping and sleeping. Okay, and we had some serious kind of motor challenges as well. Well, if you think about it, especially what pooping is in digestion, it's really just that motor processing. It is a sensory processing challenge. There is a sensation that the brain needs to recognize and say, hey, it's time to move food along. It's time to digest food. It's time to excrete and eliminate and poop out the food. Sleep is the same thing. Hey, it's time to relax. It's time to let things go. It's time to fall asleep. And so a lot of our sensory sensory kiddos not only struggle with the big emotions and the big behavior, but they really, really struggle with sleep and poop at the same time. And that was certainly Miss Maddie. So here is her initial scans on the left. We're going to zoom into these. This is where she got started. She actually came up from many hours away to our clinic outside of Chicago and did what we call a neurological perfect storm intensive, where we took care of her for 2 weeks. So you're going to see all of these sensory changes after we had the test, which tracks our changes. See, the cool thing about our sensory processing disorder test is it'll actually tell us not only what's going on, but we keep running the test to track the changes and the improvements, so we know that we're making real life change to your child's nervous system. You can tell I get a little excited about this technology. So what we see with our initial EMG, so that's what this is. This is an EMG. So what we know is right here, especially in her neck and her traps, which is where birth trauma, which is where a lot of things really set up shop, there is a lot of noise within her neuromuscular system. There is a lot of tension within that system. What we know with EMG is it is crucial, most important test for sensory processing disorder, because sensory is the most important of our 7 senses. Yes, there's 7. It's not just taste, touch, sound, those things. The 6th and 7th are movement sense, so motor, okay? And then balance. So really the vestibular sense is a function of the motor. So 6 and 7 are kind of tied at the hip, if you will. And it's really a motor test. Well, what runs the tone and the tension and the function and the coordination and the processing and the integration of the motor system into the brain? Well, the electrical system, the nervous system. So really what we're measuring here is a neuromuscular evaluation, and the G just stands for a graph because we're able to graph it. And here's what's really cool. The sensory processing disorder test we use, we're able to score it. So what we see with Maddie is we have all of this noise stuck in her neck and her neurospinal system. The neurospinal system, and especially the neck, is the most important motor conduit. I know you probably, if your child is going to OT-PT, they're talking about the core. If they're doing speech, they're talking about different things with the jaw and the muscles of speech, which is a big side, thing with sensory as well. Motor and speech challenges to go along with the emotions, the behavior. We talked about sleep and gut. But we have to really evaluate the motor tone, the neuromotor tone of the spine and the neurospinal system first. It's the most important sensory proprioception, mechanoreception regulator into the brain. So what we see with Maddie is we can actually score this. This ideal scan over here, see how it's all white? We want 3 things within our neuromuscular system. We want it to be calm. Man, my writing is not calm, right? We want it to be calm. We want it to be organized, and we want it to be symmetrical. So we can actually score how calm or not calm a child's sensory system is, how organized or not organized it is, and how symmetrical right and left brain do different things. There's 2 hemispheres to the brain, 2 eyes, 2 ears, 2 arms, 2 legs, 2 lungs. So everything needs to be coordinated. So we measure these 3 things with these 3 scores, and they all ideally should come in around 100. And so when we see that her total energy is 200, Maddie is 2 times 2 wound up, even at rest. This test, the sensory processing disorder test, is done at rest, with your child seated, with your child very, very relaxed. The second thing we see is that her pattern score is a 73 and her symmetry score is a 79. Now, that's the organization and the symmetry. That's not too bad for Miss Maddie. So what we really, really see starting out is she was so stuck in fight or flight. We call that subluxation dysautonomia, because right in here is where the vagus nerve is that is supposed to calm things down. Getting the vagus nerve online is the key to getting sensory processing and sensory integration challenges better. That's why I keep reading the articles, check out all the links. And so because she had this constant tension, 2 times as much tension even at rest, that became exhausting. So the second element of our sensory processing disorder test we're looking at here is called HRV. See, this right here means her fight or flight system, or her sympathetic fight or flight system, was stuck on. We call that the gas pedal, okay? So kids who have sensory processing, constant tantrums, difficulty with transitions, hard time falling asleep, can't handle certain textures, they're stuck on fight or flight, which is the same way as saying their brake pedal isn't working. We can measure that. So you'll see this little white dot is where Maddie plots on what's called heart rate variability, HRV scans. Key word for you to understand is the variability is adaptability, resiliency. What sensory kiddos can't do very well is adapt to their environment, either internal, external, and emotional. And so you'll see this is actually supposed to graph her heart rate. Maddie was so wound up. She had struggled so much with these sensory challenges and sleep challenges and was so equally wound up and worn out at the same time. We could barely get her heart rate to graph on here. So now let's take a look at how to make the changes. When we went through and we applied what's called neurotonal, which are safe, drug-free, so easy. When they happen, you barely even know the adjustments are happening. The way a pediatric chiropractor, especially a PX doc's neurotonal trained, I know those are nerd words, but it simply means our clinical protocols, our techniques, our approaches are designed for 1, kids, 2, neurologically, neurosensory challenged kids. And so the more wound up a child is, the more easy, the more gentle, the more relaxing the adjustments are. And that actually makes them more effective. So that's exactly what we did for Miss Maddie. And you can see, if we just look at these scans all together, all of this red, all of this noise that was really causing all of her sensory challenges, sleep challenges, emotional challenges, faded, relaxed, calmed. So we got it all the way down to blues and greens and whites. Whites is white noise, relaxing, calming, organizing, symmetrical, integrating. So now look at her scores. This total energy came all the way down to a 135, which is the exact range it should be in. For a child of her age, it should be in that 130 to 150 range. For an older child, we do want it to come all the way down to 100 or an adult. So we had almost a 70-point reduction in noise and in stress. And when her body got that much calmer, when her neuromuscular sensory processing challenges got that much less noisy, subluxated, stressed out, so we activated the vagus nerve, activated the calming, relaxing, sleeping, pooping, transition making, behavior, emotionally regulating side of the nervous system. Yeah, it's got a lot of jobs. We actually got it recharged and so much more adaptable. So you can see how much her nervous system improved with her HRV as well. You can see her heart rate now made it on the graph, and her little white dot made it right into the green on her HRV, which is the key. There is so much research to show that these sensory challenges really exist in the neuromotor system. The tone, the organization or coordination, and the symmetry of the neuromotor system is key. I know you probably have an awesome PT, OT, speech and language therapy team that is talking about motor tone with you. Pediatric chiropractors work right alongside those and look even deeper to the central autonomic neurospinal tone. And we see that so many times there was intervention, induction, forceps, C-section, vacuum that really was something that altered the neuromotor tone, created that subluxation on the neck and the nervous system. And that is the missing link that other professionals, pediatricians, and the PT-OT speech team, they don't quite know how to evaluate like we do. And even if they find it, they don't have the protocols, the adjusting, the scope of practice, if you will, to fix it. We do. We don't replace them, we add to them and get the maximum results for your child. It all starts with understanding the science behind sensory, and then it goes to the sensory processing disorder test. The EMG and the HRV are crucial for the sensory processing disorder test. And when we get them done for your child, we know exactly what we're dealing with. We know exactly where their subluxation and stress is. We know exactly how much stress, tension, dysfunction is in there. So then we can sit down with you and we can say, hey, here's the plan to take care of this. Here's how many adjustments with what frequency over time your child's going to need. The next coolest thing about the sensory processing disorder test that we use is it sets up the action plan. You get a customized, personalized, not generalized because, oh, we took a survey and your child has this, so we do the same thing for every child with sensory. We do the opposite with our PX Docs network. We do a deep dive into your child's consultation. We do their sensory processing disorder test and insight scans and really measure their challenge. And we give a personalized, customized, detailed plan for your child and what they need to get to the goals you have for them, to put these sensory challenges in the past, to see their day-to-day, week-to-week, year-to-year life vastly improve and transform. Can't wait to hear your child's story. Go to the directory, find your local doctor, get these scans, get the sensory processing disorder test for your child, and I can't wait to hear the transformative story for your kiddo after you start there, get the care plan, and get to the other side of these struggles. God bless, be well, every kid counts. See you on the next video.